one yet, so.
Right on. Thank you. No, Miss Prince is trying to be on vacation, so I'm not going to make her do it. A second, we're doing a little housekeeping at the moment. A crew here. Let me know when you're ready, Ms. Moore, and we'll rock and roll.
I just hit recording, so it should pop up any moment. There we go.
All right. The meeting of the St. Paul City Council has come to order. Roll call.
Naker.
Here.
Prince.
Here.
Tao.
Here.
Tobert.
Here.
Yang.
Here.
Jalali.
Here.
Council President Brenmon.
Here.
7 present, no one absent.
Please stand and join us as Councilmember Jalali leads us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consent agenda items 2 through 15 are before you for your consideration.
Items 2 through 15 are on consent. There's been a request to pull item number 8, as well as I'm trying to find Cultural Star.
I believe it's 4.
Number 4 and number 8. Is there anything else that should be taken separately? All right, seeing none, Ms. Jalali moves the balance of the consent agenda. Roll call.
Naker.
Aye.
Prince.
Aye.
Tao.
Aye.
Tobert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The consent agenda is adopted as amended. Item 4 is Resolution 21-1116, approving the 2021 Cultural Sales Tax Revitalization Grant Program Awards.
All right, and on this item, just I know Ms. Jalali has comment. I just wanted to also, just in pulling these off, recognize the Cultural Star Commission, and as well as next will be the Neighborhood Star Board, rather. I'm just recognizing that going through the applicants for this program is a huge job. It's a big responsibility, and we have wonderful, talented and committed people who look through these applications and make really tough decisions about where to allocate limited resources. And so before we vote on it, I just wanted to take just a quick moment to just acknowledge and appreciate the hard work of the board members on this particular fund. And then again, there's another one coming up, but it's we do really appreciate and value the recommendations that you make. I know sometimes there are some shifts and changes after the recommendation, and sometimes it's due to timing or other considerations, but we deeply appreciate the heavy work that goes into the initial recommendations that come to the mayor's office and then to the council. So thank you and gratitude for that. Ms. Prince.
Yeah, I want to acknowledge, I just saw the email that came in from Mixed Blood Theater with their concerns that they had been one of the recommended projects, and that they had been taken out afterwards, after the mayor's deliberations. I wondered if we had any information on that and what, in terms of what replaced them. I'm concerned about it. It sounds like they had been previously funded for this through Cultural Star, and the project couldn't happen last year. And they came back this year and were recommended. Is there any staff person here who could let us know what got traded out or traded in for it?
Hello, Council President Brimoen, Nicole Goodman here. I'm checking to see if we have staff that are well versed in how the.
I know that these questions have been asked today at City Hall, and unfortunately haven't had a chance to loop you and Ms. Prince on those conversations because I think that email went to every council member.
Mm-hmm.
Okay. Is Michelle Swanson on the line?
Nope, it doesn't look like it. Ms. Naker, did you have something to add?
Thanks, Council President. I had the same questions, and I just wanted to share that I did have a chance to talk to Noel Nix earlier today, and he shared with me that in the administration's, and again, I welcome anyone from the administration to share as well, but what I heard was that in the administration's deliberations on this, given the limited number of dollars and the great number of applications as always, priority was given to organizations in St. Paul and organizations doing work in the cultural district, and organizations that were coming from outside St. Paul doing work outside the district were not prioritized. And as I looked through the applications, that was consistent across all the applications. So just wanted to share that.
Thank you. That's very helpful.
Right, and I think I was not privy to those conversations, but those are two very true statements about both. I think one of the things that's so challenging and frustrating about, as I said earlier, the fund is that they're so very limited.
Right.
It certainly isn't a reflection of the value that we place on the location or the organization. So, but I appreciate the question, and it looks like that answered your question. Is that true, Ms. Prince? Okay.
Yeah, thank you for that. I do appreciate the fact that the funding is really is very tight, and we have to make some tough choices. This is a tough one.
Yeah, definitely. Well, and thanks for asking the question. So we have, if there's no other questions on the topic, I will go to Ms. Jalali.
Thank you. I really echo appreciation of staff for hard work reviewing these important applications. I simply wanted to make clear I'm recusing myself from this vote today, and my explanation is that due to some recent part-time employment I've acquired with an organization that works with one of these awardees, I'll recuse myself in order to comply with our ethics rules and act appropriately. That includes not benefiting financially in any way from these contracts. This is also with guidance from our city attorney, whose help I greatly appreciate, and I look forward to attending these events in my district as a councilwoman, and am greatly appreciative of all these creative endeavors, but will be recusing myself today. Thank you.
Thank you, Ms. Jalali. And I think better safe than sorry, so I appreciate your prudence on this. Any other discussion before we go to a vote? All right, seeing none, Mr. Tao moves the resolution. Roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Council President Brenmon.
Aye.
6 in favor, though zero opposed with 1 recusal, Councilmember Jolly. The resolution is adopted. Item 8, Resolution 21-1194, approving fiscal year 2021 neighborhood sales tax revitalization loan and grant awards.
All right, and again on this item, huge gratitude to the large group of folks who have volunteered to serve on the neighborhood sales tax revitalization loan and grant award board, the STAR board. We appreciate your work, and again know that it's a fund that is oversubscribed and that you did yeoman's work trying to use you know a system that would help measure this year's awards as well as going forward. And I would just really appreciate your work and effort on this so much, and the recommendations that you're bringing forth to us. And we will beat the bushes to try to find more money to send your way for future STAR grants. We know it's a challenge when there's so much interest and not as much resource to pass out. I will also take this opportunity to say I look forward to a full board. The STAR board, by the time we got around to voting, was rather thin. I felt like Ward 5 had maybe one voting member that was participating at the time of the votes, and it's important that we keep those spots filled. And I know it's a full-time job for the administration to keep those spots filled, but I do think there's a reason why there's 3 from every ward. And I want to make sure that if we lose people, that we fill in those spots and make sure that we have full representation as intended. So with that, I will just yield the floor if anyone has comments about the recommendations of the neighborhood STAR boards grant money. All right, looks like there is none. So Ms. Prince would move approval. Any discussion? Roll call.
Naker,
Aye.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The resolution is adopted. Item 16 is a staff report update on COVID-19 from Ramsey County Public Health.
Great. And we have Laura Anderson in the house today, and I believe Sarah Holly as well. It's an exciting day for us. Welcome to you both.
Thank you so much, Council President Brenmoon and council members. I'm going to let Sarah Holly go ahead and introduce herself for those of you who have not met her yet.
Good afternoon. Thank you, Council President Brenmon and council members. It's a great opportunity today for me to meet you all via Zoom or via Teams, right? Zoom Teams. So it's really exciting to be here, and I hope to meet you all one day in person at some point. But it's just an honor and privilege to be appointed St. Paul Ramsey County Public Health Director on July 26th. So I think I'm in my 4th week, if I'm counting that right, as your public health director. And I come to this work with 17 years of public health experience. Prior to coming to Ramsey County, I worked at the Department of Health for 13 years in a variety of capacities. And so I have a passion and love for public health and community. And prior to that, I have been at Ramsey County since 2019, serving as the Health and Wellness Service Team Race and Health Equity Administrator. So really excited about this opportunity to come back home and do this work, to partner with council here, the mayor's office, and to continue this important work in public health. I really want to have a shared vision, both with community and our public health department, and of course, leaders like you. So it's an exciting opportunity. We have a lot happening. We're still responding to COVID, why Incident Commander Anderson and I are here today to give you all a COVID update. And we are in response mode each and every day as a part of our St. Paul Ramsey County Public Health Incident Command. So I will turn it over to Incident Commander Anderson to kick us off with our COVID-19 update. But I really look forward to joining you all as much as possible and bringing these COVID-19 updates back here. Thank you.
Wonderful. Thank you and welcome. It's great to have you. Came in at
So
a good time.
We're very grateful to have her. I'm going to go ahead then and share a PowerPoint presentation if I think I can. Give me a moment. Okay, guys. Going to go ahead and just briefly share with you all where we are in terms of our situation update for COVID-19. The last time that Public Health had a chance to present to you all, I think it was back in June, and we were in a very different place. We had seen our cases decline considerably, and positivity rate going down, hospitalization going down, and unfortunately, we are now in a situation where we are certainly seeing our cases increase. And you can see here, take a look at our open data portal if you have not recently. We do keep tabs on all the cases that are diagnosed here in Ramsey County. We're also keeping track of positivity, and again, you can see those numbers increasing over time. What positivity is, here what we're looking at is among those who are tested for COVID-19, how many test positive. So just a reminder that if you don't go get tested, of course, we're not necessarily going to be able to fully understand where we are in terms of this ongoing pandemic. Taking a look at hospitalization data, this is also very concerning for us here in public health, as well as you all representing your constituents. We are certainly seeing increasing numbers of individuals being hospitalized with COVID-19. What's interesting about this data is that currently individuals who are being hospitalized are those who are not vaccinated. So we do have very strong evidence to demonstrate how protective our vaccines are against hospitalization and death. But for individuals who have not yet been vaccinated, we're really concerned about those folks. And I think, I'm sure you have all been following the news here. Really what this is all about, frankly, is the Delta variant. It's true in Ramsey County. It's also true across the board here in Minnesota, as well as nationwide. Most areas of our nation are at what's called high transmission of COVID-19. What that means is we're seeing a rolling case rate of around 100 cases per 100,000 individuals. When spread is that high, it's really important for us to be, actively engaged in mitigation. Well, what that means, of course, as you all know, is wearing masks in indoor facilities, wearing masks in outdoor facilities when they are crowded, encouraging each other to seek vaccine, doing our part really to find ways to work and play safely. A very different place than we were back in June is what I would say.
Ms. Anderson, are you, perhaps you're just about to explain this, but I don't understand what the graphic is.
Yes, I am. I scrolled ahead a little too quickly. So the graphic that you're seeing right now is a new dashboard that we have been monitoring, and I will go ahead and put that in the chat for you all for your review. It's from the Centers for Disease Control. What they have been tracking, again, nationwide, is a combination of metrics that looks at positivity, test positivity, as well as case rate over time. They're putting those two measures together, and that's how they're coming up with standards for us to use nationwide that allow us to move more confidently in our mitigation strategies. So I know that's something that this council, we had been looking for and asking for was, some continuity around the guidance for mitigation. And I think that our federal partners have been great in providing that guidance for us. So yes, you see a whole lot of red here in Minnesota, and what that's indicative of is consistent high transmission of the Delta variant in our communities. It's unfortunate, but it's real, and I think it's important for us to recognize, when we're thinking about how to approach fall. Here in Ramsey County, the 7-day rolling average is 128 cases per 100,000. That's pretty high. It's concerning for us. And if you go take a look at that dashboard, which again I will put in the chat for you all, you'll see comparatively high rolling averages across the 7-county metro. The one, if there's any silver lining here, and I'm not sure that there is necessarily, the news around Delta really has helped spur a lot of residents to seek vaccine. So we've seen consistent increases in vaccine uptake across all our zip codes, across Ramsey County, across the city of St. Paul, 1 to 2 percentage points each week, and that's awesome. We really need to stay the course. We want to make sure that we get to that 70% of folks being vaccinated across every zip code, and then we're going to go further. We have a strong plan in place for the fall with regards to vaccine clinics and other initiatives, which Sarah Holly will share with you next. So it's just very important for us to stay the course here and to stay, consistent on messaging and communication to our constituents. This is a really hard time. Folks were getting relaxed and having a chance to enjoy their lives. So it's a tough message to share, but we really want to push forward and remind each other to stay safe, seek the vaccine, practice social distance, all of those activities at this time. So I am going to go ahead briefly. I'm going to cede the mic to my colleague, Director Holly, and she's going to share more detail around some events that have occurred since the last time we met with you all.
And quickly before we move to Ms. Holly, I just wanted to let you know, Ms. Anderson, that per the law, the chat function is actually closed during the meeting.
Oh, okay.
So if
Great.
you could just forward and send those to Sherry Moore, she will deliver them to the council members through email. It's just so we're not chatting.
Understood.
Yeah.
Okay.
Okay.
Thank you. Thank you.
Thank you, Council President, because I was attempting to put that information in the chat and realized I could not. So
not working.
I can't share with you all in real time. My apologies. So in other news, we do have some good news. So I know Laura just gave you kind of the overview of the current state of where we're at with COVID, and just wanting to stress that the Delta variant is putting us in a very challenging time. And so we are really grateful that our emergency use authorization for Pfizer for 16 plus has been lifted with fully approved by FDA on Monday of this week. So we're really happy to see that. And I think for many of our community members that have been truly hesitant or just waiting for that authorization, I think we have an opportunity here. So we were glad to see that fully approved by the FDA. The third dose recommendation for immunocompromised individuals. Again, the recommendation right now is for a very, I think, targeted population that should be seeking that third dose in the series of doses. And so we can answer more questions related to that, but that's it's a very small proportion of our population that would qualify for that. And that's based on our CDC recommendation. And so we can answer questions related to the third dose recommendation, but right now it's really for that targeted group. As you all know, St. Paul and Minneapolis mayors, thank you, and Ramsey County Manager O'Connor reinstated our mask mandates. And as Incident Commander Anderson mentioned, we did that in response to recommendation by Public Health, but also looking at the community transmission image that Incident Commander Anderson just showed. We monitored that for a few weeks, and we saw that Ramsey County quickly, along with Hennepin County, moved into that high community transmission level per the CDC tracking. And so that mask mandate, again, is something that was a recommendation of Public Health. We're also seeing St. Paul Public Schools requiring masks, and St. Paul and Ramsey County approving a vaccine or test requirement for staff. So again, masking is particularly for our 16 and under population that cannot receive the vaccine at this time is really important as a part of our mitigation strategy. So we want to make sure that our kiddos that are going back to school this fall are masked. And so we were really happy to see that recommendation around masking for students, staff, and visitors in our schools is moving forward. And then just noting that the State of Minnesota Incentive Program was extended this month to August 22nd, and Hennepin and Ramsey County are sustaining our efforts in that manner also. So those are just a few highlights that we wanted to share here with you council members today. And I think I'm turning it back over to Laura.
Yeah, one of the programs that we're excited to participate with, if any of you are attending the state fair this year, the Minnesota Department of Health is going to be offering vaccine. I believe I need to make a quick edit to this slide because I think the $100 incentive is for Minnesotans receiving their first shot only. So sorry about that, but still a really great opportunity to go ahead and get that first shot if you haven't yet. MDH will be running this clinic all 12 days of the fair, starting tomorrow, 9 a.m.